All right, guys, welcome back to Underground Science. In this video, we'll be talking about fat embolism syndrome. Okay, so let's go and get started. So, how does the pathophys work, right? So, you get some sort of trauma, all right? Trauma from what, right? Or trauma to what, right? So, it's usually a long bone fracture, all right? A long bone fracture, so like your femur, for example, right? And why a long bone fracture? Because they have yellow marrow, right? Which is rich in fat. So you get trauma, right? And we just said our long bones, like our femur, for example, is rich in yellow marrow, okay, which contains a lot of fat. So if you fracture your femur, the fat in the yellow marrow can release from your bone marrow, okay? Or the fat from your yellow marrow, I should say, can get released. All right. And when that fat gets released, it can form fat globules in your bloodstream and block off vessels. So you can get fat emboli. All right. And this leads to endothelial damage too, which we'll talk about in a bit. But to expand on this, there's two main ways, right, that fat embolism syndrome can happen. So the first way is mechanical obstruction. So you get a fracture, right, a traumatic event, then that leads to fat being leaked out, right? So fat leaks out into your veins, right? So if we draw like a bone diagram here, right? And you fracture your bone, right? So then you're going to get fat that can leak out and go to your and enter your damaged veins, right? So it can enter your veins, all right? So you get a lot of fat globules into your veins. And where do veins go, right? Remember, our veins will go and will give this blood to the right side of your heart. All right, so it's going to bring this blood, right? Your veins bring blood to the right side of your heart. So they're going to dump this blood, okay, into your right side of your heart. So it's going to eventually go to your right atrium, okay? Then from your right atrium, it's going to go to your right ventricle. And then from your right ventricle, these fat globules will be pumped out into your pulmonary vasculature, right? And if we have our pulmonary vasculature here, right? Let's say this is our pulmonary capillary, and we have our alveoli like that, right? Then and if we get fat globules here, and they can, and then this increases the chance of blockage, right? So if we get fat globules here, this can lead to fat emboli, right? That block off your pulmonary capillaries, okay? So that's one way where fat embolism syndrome can affect your lungs. Okay. So but what if, right? It goes to the right side of your heart and, but, but fat embolism syndrome not only affects your lungs, it can affect your brain and skin. So there's actually a triad that we should remember that we'll visit in a bit, right? For fat embolism syndrome, is it can affect your lungs, your brain, and skin. Okay. So we talked about how these fat globules can form, right, in your pulmonary vasculature, blocking blood flow, right, in your blood vessels that are part of your respiratory system, right? So your pulmonary vasculature. But then how do we affect the brain and skin? So the thought behind this is, remember, we get our veins drain back into our right side of your heart, right? So you fracture your bones, fat can leak out into your veins, right? Then the veins can bring those fat globules back to your right side of your heart. But what if you have a patent foramen ovale? Okay. So what if this is your right atrium, right? Let's say that's your right atrium, and then we have a right ventricle, our left atrium, sorry, right? And then if we just draw all the parts separately, right? Let's say you have your right ventricle here and your left ventricle here, right? And what if you have an opening, right? An atrial septal defect, for example, right? So that what's an atrial septal defect? Opening between your right and left atrium. Okay, so if we have fat globules here, right, in your right atrium, then these fat globules can enter and directly enter your left atrium, then go down to your left ventricle, and then be pumped systemically, right? And then go and lodge into your brain, right? Blood vessels in your brain. And then you can also see skin symptoms too, right? And so that's how these fat globules can enter in your systemic circulation. Okay, so that's, but then you can take the same example and say, what if you had a ventricular septal defect, right? Which is an opening between your right and left ventricles. Then again, fat globules in your right ventricle can enter your left ventricle, then go and get pumped through your aorta and enter your systemic circulation and affect your brain and skin. Okay, so we have a main triad that we should know in fat embolism syndrome. It can affect your lungs, brain, and skin. Okay, and we'll go more into that in a bit. So that's one way, right? Another way is inflammation. Okay, another way you can get this fat embolism syndrome is through inflammation. So once these fat globules, right, are in your bloodstream, right? So if we draw our endothelial lining like this, right, for example, and we have our fat globules like this, right, and it's in your bloodstream. Remember, these fat globules can get broken down into fatty acids. Okay. So when these fat globules get broken down, right, into fatty acids, remember fatty acids are damaging to your endothelium. Okay. They can damage your endothelial lining. Remember, if you have endothelial damage, that induces platelet aggregation. All right. So you attract more platelets to these fat globules, right? So if we draw platelets in green, let's say, right, more platelets come to this area. And also, if you damage your endothelium, you make your endothelial lining more permeable. Okay, so you can get fluid leakage, right? You can get fluid leakage. Okay, so if this is happening in your pulmonary vasculature, this can lead to ARDS, right? ARDS. Okay, so acute respiratory distress syndrome. So, for example, right, if we draw an alveoli here, okay, and you have your pulmonary capillary right here, right, and you have these free fatty acids and fat globules, right, and then you have your free fatty acids, let's say like this, that are damaging your endothelial lining, right? You make your endothelial lining more permeable, and this leads to acute respiratory distress syndrome. All right. Because again, these free fatty acids damage your capillary membrane in your lungs, right? Then that means you get more permeability increases because your endothelial lining is damaged, right? So stuff can leak out now. And what leaks out is protein-rich fluid. So if protein-rich fluid now, right, can leak out, then this protein-rich fluid, right, can fill your alveoli, right? So you have a bunch of protein-rich fluid that's filling up your alveoli. And if this is happening diffusely across many alveoli, that's acute respiratory distress syndrome, right? So you can become hypoxic because now imagine, right, oxygen in your alveoli trying to get across this thick membrane, right? It's going to have much of a harder time diffusing from your alveoli into your blood. So that's why you can see hypoxia, right? So you can see your PaO2, right, decreased. Okay, so if you did arterial blood gas, you'd see a low PaO2. And then if of course if you did an X-ray, right? Remember what does ours look like on an X-ray, right? Remember that phrase, a ground glass appearance. Okay, so you can expect a ground glass appearance when dealing with acute respiratory distress syndrome when you do an X-ray. Okay, but let's talk about Let's talk about the triad more, okay? Respiratory symptoms, neurological symptoms, and skin symptoms. All right. So let's see. So we already discussed this part, right? So let's talk about the triad. So respiratory symptoms, right? If we get fat globules that lodge in our blood vessels of our pulmonary vasculature, right, or of our pulmonary system, okay, like our pulmonary capillaries, for example, then we can get respiratory symptoms, right? Like basically pulmonary embolism symptoms, right? So if you get these fat globules, these fat emboli in your pulmonary vasculature, your pulmonary capillaries, then of course you can get respiratory distress, right? Maybe even pulmonary embolism symptoms. And plus, these fatty acids damage the endothelial lining, remember, which we just talked about, can lead to protein-rich food leaking out and filling your alveoli, which thickens the membrane of your alveoli, right? And if this happens diffusely across many alveoli, this can lead to acute respiratory distress syndrome, which is also can also contribute to hypoxia, right? So that's respiratory. Okay, and so if we talk about neurological symptoms, right, fat emboli can reach the brain, all right, and maybe block off certain blood vessels supplying brain tissue. So this can lead to things like stroke-like symptoms, right? Or even confusion or agitation or seizures, right? So you can have neurological symptoms there. And then what if these fat emboli, right, block off certain capillaries supplying the skin? And remember, we said that all of this attracts platelets, right? So if we have our blood vessel right here, and we have our endothelial lining like this, right? And then we have our fat globules, right? Our fat globules like this, with our free fatty acids, of course, damaging the endothelium, which attracts platelets to this area, right? So you're attracting a lot of platelets to these fat globules, right? And if this is happening diffusely across many capillaries, supplying your skin, right? Then you're going to be using up your platelets. So you're going to get thrombocytopenia, right? You can get thrombocytopenia, okay, because you're using a lot of platelets because these platelets are getting attracted to these fat globules, right? And of course, thrombocytopenia, we know, can lead to skin bleeding like petechiae. So you can see a petechial rash, okay, which is part of the triad of fat embolism syndrome. Where would you see this petechial rash, right? So again, you can see a petechial rash, and the most common places to know, right, to keep in mind is the neck, chest, and armpit area, okay, also called the axilla. All right, so that's important to keep in mind. Petechial rash in three main places, like the neck, the chest, and your axilla region, right, or your armpit region. So that explains the triad, right? Respiratory symptoms, neurological symptoms, and petechial rash. So then if you did labs, like we talked about, right? For example, if you did a CBC, okay, if you did a CBC, right, what can you expect to find? Well, if you looked at your platelet count, right, because you're consuming a lot of platelets to adhere to the fat globules, right, that are binding the fat globules, because we were getting platelet consumption because they're binding to the fat, then you can see low platelets. Okay, so that should make sense too. And of course, we said we get petechiae and you're consuming platelets, so you may have bleeding, so you may see a low hemoglobin level. Okay, so those are things to keep in mind. But if you did an arterial blood gas, like we talked about earlier, especially if you have acute respiratory distress syndrome, right? Or if you have fat globules that are blocking up pulmonary vasculature, right? Then you can see a low PaO2, right? Why would you see low oxygen if you have fat globules blocking off pulmonary vasculature? Well, because remember, your right ventricle, right, sends deoxygenated blood, right, to your lungs. So your lungs can oxygenate that blood, and then so that oxygenated blood can go to your left atrium, and from your left atrium to your left ventricle, and from your left ventricle to your systemic circulation. Now, if you have fat globules, right, blocking off your pulmonary capillaries like this, then you're going to have less less blood that's able to make it through your lung pulmonary vasculature, which means less blood, right, will be able to get oxygenated. So that means you're going to have less oxygenated blood returning to your left side of your heart, which means less oxygenated blood will go to your systemic circulation, which can lead to things like cyanosis and hypoxia. So that's why if you do an ABG, you can see a low PaO2 level. Okay. And of course, another reason we already talked about is if you have acute respiratory distress syndrome, right? You have all that protein-rich fluid filling up your alveoli, thickening that membrane. So it's harder for oxygen to diffuse from your alveoli into your pulmonary capillaries, right? So that's another reason you can see a low PaO2 value or hypoxemia. Okay. And of course, we know that hypoxemia, right, or low oxygen levels in your blood, right, can trigger a reflex, right? So your brainstem can send signals to your respiratory muscles to breathe more, so that in the hopes of getting more oxygen inside our bloodstream. So if you're breathing a lot or you're hyperventilating, right? So low oxygen can trigger hyperventilation, right? If you're breathing out like that, this can lead to respiratory alkalosis, okay? Respiratory alkalosis because hyperventilation, right? You're trying to take in more oxygen, but remember, you're also breathing out a lot of CO2 if you're hyperventilating. Okay, and remember CO2, right? When it combines with water, it can form carbonic acid. And if carbonic acid dissociates, it can dissociate into hydrogen protons and bicarb. So if you're breathing a lot of CO2 out, right, you're becoming more alkalotic because technically you're reducing the hydrogen protons, and hydrogen protons are acidotic in nature. Okay, so that's why this can lead to respiratory alkalosis. And we already talked about chest x-ray, right? Especially if this patient has acute respiratory distress syndrome, right? So diffuse pulmonary edema or diffuse protein-rich fluid leaking to the alveoli, you can see a ground glass appearance, okay? And then those are the main labs to know, all right? So, and that's basically fat embolism syndrome. Okay. So if we just keep those in mind, right, we can have a decent understanding of fat embolism syndrome. And then, of course, now would be a good time to move on to the management or our treatment, right? So the treatment would just be basically trying to do supportive care. So things like oxygen therapy, right? So with the hopes of increasing oxygen, because remember one thing we found in this was low PaO2 levels when we did the ABG, right? So you would try to give more oxygen. Okay, you would try to give fluids. All right. And then of course, if we see this fracture out in the field, right, as an EMT or medic, for example, right, in EMS, you would want to mobilize this fracture or you would want to stabilize this fracture as soon as possible, right? So early fracture stabilization would be another important thing. Okay, so early fracture stabilization would be an important thing, important factor to keep in mind because if you splint this, right, if you splint this traumatic injury as quickly and efficiently as possible, this will reduce the movement of that limb, which means reduced chance of fat emboli, right? Reduced chance of fat emboli, reduced chance of these fat globules entering your bloodstream. Okay, so that's one benefit of stabilizing an injury like that. All right. And then, of course, if this patient were to have acute respiratory distress syndrome, we know that can lead to severe hypoxia. So mechanical ventilation can be an option for that too. All right. And we already talked about fluids, right? And then would you give anticoagulation? Because remember, these can block off blood vessels. So you wouldn't, anticoagulation here wouldn't really help much, right? At all, because we're not dealing with clot formation here. We're dealing with fat emboli. Okay, so anticoagulation won't really do anything because there's no widespread thrombus formation, all right, or widespread thrombi formation. All right, so that's the main ways you can manage fat embolism syndrome, right? And just wait for natural clearance of these fat emboli, right? Because remember, we have macrophages and lipases, right? That will try to break these fat emboli down, or macrophage will try to phagocytose, right? The triglycerides or fatty acids or these fat emboli, and then it'll just take time to clear these fat emboli away. All right, so until then, you just support organ function so you can do supportive care, right? Like oxygen, right? Mechanical ventilation, fluids, right? To support your kidneys so you can maintain perfusion, fracture stabilization, and things like that. Okay. So that's basically it. That's fat embolism syndrome. Hopefully this video helped a little bit. Hopefully it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.